Hi, you guys. We made it. It's Friday. Welcome to Ask the Fertility Experts, and I'm going to be joined by one of my best friends, Dr. Catherine DeUgarte. She's a fertility doctor in LA, and we've known each other since we were tiny little baby makers way back in the day when, I don't know, when people were still doing day 3 embryo biopsies, and we didn't even know what blastocysts were, and we had no idea what PGTA was. That's how long I've known her. I've actually known her so long that we actually have a September 11th story. We actually knew each other, and we knew each other quite well, and she was in Boston on September 11th, so I'm sure she's going to share that story with us as well. So I'm just going to wait for her to join me. Catherine, I'm just going to pull you up right now. There you are. And you're going to join us right now. Thank you guys for sending in all your questions. I'm super excited to go through them with her. Hi, Catherine.
Hi, how are you?
I'm doing good. I was just telling everyone how long I've known you and that we have a September 11th story.
I know, it was such a crazy day. Where were you on September 11th?
I was in LA and you were in Boston, remember?
That's right. Yeah, I'm trying to remember because I was definitely in Boston. I remember that. And you were in residency in LA. You were covering for me.
Yes, exactly.
Because I think I got stuck in Boston, unfortunately, a little bit longer than expected. Yes, I was interviewing for fellowship, and I was supposed to be on the Boston-LA flight, actually, the next day. It's a crazy, it was a crazy day. But
not to get too deep, we live for those people who can't be here today.
I know.
Life
it was
is
just such a sad day.
Damn precious. So each of us that's here, and you guys are all watching us because you guys are sparkling inside, right? Super cheesy, right, Catherine?
Yeah. I mean, it really makes life worth living.
Absolutely.
Living through that.
Catherine and I have so much fun talking about how we can help patients because it brings us so much joy each and every single day. Okay, so we can talk about this all night long, but we want to just get to your questions. So, Catherine, are you ready?
I'm ready.
Okay, so this is from Melissa. Melissa asked this question: do endometriomas go away on their own? I had one that was 13 millimeters a few months ago, and now it's not seen on monitoring ultrasounds. What do you think, Catherine?
I have seen them go away, but usually when they go away, they probably weren't endometriomas to begin with. They're probably complex cysts for different reasons. But I've had patients with endometriomas for their first baby, second baby, third baby in the same size. They kind of just hang around there.
Yeah, and then sometimes they're hormonally active, like you think they're gone and then they show up again. So you just have to look really carefully. I totally agree with you. Okay, this is a question from Joyce. Thank you, Joyce, for sending this in. Dr. Aimee and Dr. Catherine, how do you think, how important do you think it is to do the DNA fragmentation test? The reason I'm asking is because my doctor never mentioned anything about it, but I saw some videos about the potential importance of doing it. And then if there's a problem in DNA fragmentation, can this sperm be able to develop into a blastocyst, and would it pass PGS testing? Many things.
So in terms of the fragmentation test, I don't think it's something that everybody needs, but I definitely think it's very valuable when patients have failed IVF cycles, if they have all abnormal embryos, or unexplained infertility, or especially miscarriages. Patients have had miscarriages or recurrent pregnancy loss. I think in those scenarios, it's very important to do it. But I have seen patients with completely normal sperm fragmentation have trouble getting pregnant. And I've had people with abnormal sperm fragmentations have babies. So it's not 100% accurate sometimes, but I think it's important information.
Yeah, and there's so many other genes and tests that are related to male infertility as well, and DNA fragmentation does not certainly tell us the whole story. And I saw Dr. Blake Evans, I had him on the show about 2 weeks ago, and he brought up an interesting statistic that almost 40% of guys who have an abnormal sperm DNA fragmentation will have a normal semen analysis.
Yeah, and it's interesting because I had a patient recently who had a normal semen analysis, but a completely abnormal fragmentation. So that was interesting because I thought they go hand in hand usually.
Right. That's what I used to think too, that I would say, oh, we don't have to do that test. It's not a big deal. But now I'm like, oh my God, you're going to put yourself through shots and ultrasounds and surgery to have a baby. He can do an extra test.
Right.
Okay. This is a question from Jamie. For personal and religious convictions, can a patient choose to only do the IVF process? I think what she's asking, can she choose the number of eggs that she fertilizes and control the number of embryos that are created? What do you think?
For sure. I've actually had patients with that situation where they just didn't feel comfortable freezing a lot of embryos, or they thought that if they have 3 embryos, for example, they're going to have to go through all of them. They won't feel comfortable keeping them in the freezer. So what we usually do is we talk about what is our goal, how many babies, and what do you feel comfortable in terms of how many babies you want to have. And then we backtrack in terms of how many eggs we fertilize, because if you fertilize 2 eggs, doesn't mean that both will fertilize and both will make it to day 5. So I kind of go through the half of the half of the half process to figure out how many eggs should be fertilized. But I have done that. In the past, the gift procedure was also done for patients in this scenario as well, but that's not done anymore.
Right. The gift procedure.
Remember that?
Yeah. I kind of like, I wish the trigger shot, that name could be changed into like the gift shot or something like that.
Because that's been a gift to us infertility doctors, the Lupron trigger. For sure.
True. Okay. Here's a question from Catherine.
Not for me.
She has your name, but it's not.
I asked my own question. I snuck it in.
Here's her question. I'm 41 years old. My AMH is 1.5, FSH 5.3, LH 5.1, no PCOS. Was taking DHEA for egg quality for several months, monitoring my testosterone levels periodically, and it's never been high. I recently did a testosterone priming IVF cycle at the recommendation of my RE. I checked my testosterone level 2 weeks after my retrieval, and now my testosterone is high. Total testosterone is 91, free T is 1.06. I'm about to do another retrieval cycle next month, hopefully, but I'm worried my testosterone level is going to ruin my egg quality. Should I delay the next retrieval until it gets back to the normal range? Also, second question, how many embryos should I have at my age before attempting a transfer? We want 1 to 2 kids. I currently have 2 embryos that have normal chromosomes frozen.
So I'll take the last part of the question because that's easier. I usually recommend 2 embryos per baby. So ideally, if she wants to have 2 babies, I would say 4 normal embryos would be ideal. In terms of the testosterone, I don't think you do either. I don't use testosterone in my stimulation medication. I don't find it helpful. And, you know, from polycystic ovary patients, their testosterone sometimes high. And so sometimes that does interfere with egg and embryo quality. So I would think of the testosterone, if you know it's high, maybe best to wait 1 more month. But I'm personally not a big fan of testosterone protocols.
Yeah. I know a lot of people use it, and when you use testosterone, your testosterone is going to go up. So, yeah. I mean, my thing is, if that's your doctor's special sauce and they love it, like they got you 1 to 2 normal, or they actually got her 2 normal embryos already at 41. So don't mess with the sauce, but every doctor has their own sauce.
Exactly.
Okay. This is a question from Mona. She's from Melbourne. I'm 39 years old, trying to conceive for about 2 years now. My AMH is 4, and my ANA is, the titer is 1 to 1280. Okay, my doctor suggested I do IVF. Here we go. First cycle, I used Gonal F, had 8 eggs, just 2 are mature, and after day 1, no eggs fertilized. I'm sorry, Mona. Second cycle, I used Menopur 600. It looks like an antagonist cycle also, had 3 eggs, which were mature, and again, no eggs fertilized. And we did ICSI. Then we went to another, it looks like, fertility doctor. And my husband did a DFI, a DNA fragmentation. Are you ready for this? 42.
Wow.
So for those of you guys who don't know that, that's really high.
High. Now
I went to another fertility doctor for a third opinion, and I'm going to continue with her. She suggested ICSI with spindle visualization, hyaluronic acid sperm selection, which is basically PICSI and IMSI. Also, I did endometrial scratching and my natural killer cells are high, and she said to use Testigel and then a couple other meds that we don't use because they're in Australia. What are your suggestions? Do I have a chance to become pregnant? So what would you do, Catherine?
Well, her AMH was really good. I would probably try a different protocol. Maybe a Lupron protocol or a different protocol than she's tried. Sounds like she used Menopur alone for the second cycle.
Yes.
Maybe a combination, Gonal F or Follistim, whatever they have there, with Menopur as well. I would do 3 months of supplements for her husband since her fragmentation's high. I would also want to make sure that he sees a urologist, make sure he doesn't have varicocele or some other anatomic, God forbid, a cancer there, to make sure the hormones are good. So I would get him all checked out and better DFI before proceeding with another cycle personally. I would definitely do ICSI, obviously, but I wouldn't just jump into another cycle. I would give
Yeah.
it some time for the supplements to kick in.
So I think her AMH is 4, and I think in Australia the units are different. So I think 4 actually might be low.
Might be
That's
low
what
for
I'm
us.
thinking. It
That's
might
what I'm
be.
wondering.
I think it's probably like equivalent to our 0.6 or something like that, but I'd have to verify. So I agree. A different protocol, maybe a hybrid protocol, maybe Femara with Menopur. And I would say potentially even a sperm extraction and not ejaculation, then with that kind of DFI, that might be helpful. And you guys all know the balls method, right? Ballsmethod.com.
Mm-hmm.
I just got my patent, my trademark.
Did
It
you?
just came in the mail. Yeah.
That's awesome.
So I'm trademarked in the US, UK, and EU. And maybe I should be trademarked in Australia too.
I think you should.
Okay. This is a great question from, and then you mentioned testosterone, Catherine. I don't think enough people know about Clomid and Arimidex and HCG shots for guys too.
Right.
I bring it up to people and they're like, really? I'm like, how did you guys not know?
It helps.
I think it helps. I agree. Thank you for agreeing with me. Okay. So this is Brittany. She did an HSG in 2017, which confirmed blockage in the right fallopian tube. In 2018, she had a laparoscopy to remove scar tissue. Then she did an HSG September of 2020 that confirmed no blockages. But she hasn't been pregnant in 4 years. Catherine, would you recommend IUI or IVF? And I don't know how old she is. She did not share that.
Well, first of all, I would want to review the films for the HSG to make sure there isn't a hydrosalpinx, because there may be some scarring in the fallopian tube. So even though there's a block before, now there isn't, maybe there's something wrong with the fallopian tubes. And again, I'd want to know, just like you said, the age, other hormonal levels. And then you could always try an insemination if she's young and the sperm looks good, but I would monitor her really closely for ectopics just in case she gets pregnant and there's some tubal factor.
Yeah, I mean, my thing is if you're a young woman who's been trying for over a year, your tubes are blocked until proven otherwise. And it sounds like there's a tube story. So unless, you really are motivated to not do IVF, maybe even consider a laparoscopy to really see what's going on. But Catherine and I are both of that opinion. If you don't see it with your own eyes, you can't believe it. So you have to look at those images and see truly what's going on. Okay. This is a question from my mother, Nina. I'm just kidding. My mom's name is Nina, but this is not from my mom, Nina.
Okay. Is she having another baby?
She could be. I mean, she is my mother. Even though she's had a hysterectomy, I could possibly make that happen. Hey, Dr. Aimee, love your shows. You're the best. Why, thank you, Nina. That is my mother. Planning to do an IVF transfer, but before that, I have to take care of hydrosalpinx in both my tubes. My doctor wants to clip them instead of removing them due to scar tissue. Not sure what's best. I've been reading a lot about it, and it seems tubes can cause ovarian cancer if not removed. Please recommend what you would do and how I should position myself if your recommendation is different from my doctor's. Thank you so much. Keep being awesome and super funny. Someone thinks I'm funny.
Oh, you are. And you're very awesome, by the way.
Thank you. I love you.
So in terms of the hydrosalpinx story, so I personally like to block the tubes and not remove them, because I feel like,
it's going to be a tiebreaker, you guys. You might have to arm wrestle over this.
Over Instagram. So I like to block them, and because I think that it does decrease blood flow to the ovaries. So I do recommend doing the IVF first, removing the eggs, making them into embryos, and then taking care of the surgery, because I do think that you could, God forbid, lose an ovary if there's complications from the tubal surgery. It's a lot more complicated to remove tubes when there's a lot of scarring, and a lot of these patients, because I've seen them, these tubes are wrapped around the ovary, so it's actually hard to remove them. What breaks my heart, I had a patient recently who had her doctor look inside to remove her tubes, and she had so much scarring that he basically looked inside and just closed instead of just blocking them. And now she has to go through the whole surgery all over again, and it just breaks my heart that she has to have surgery again. But so I do recommend blocking over removing it. In terms of the cancer risk, I think if you don't have a family history of ovarian cancer, I think there was a study, I think when we were residents, that if you look and somebody doesn't have ovarian cancer or tubal cancer at the time of laparoscopy, the risk of getting it in the future is very low, because at that point, the person's already in their 40s.
Okay, so I'm going to break the tie now, because you now agree with her fertility doctor. So I'm going to say, I agree with you. I would create, are you flipping me off?
No, I'm just scratching.
You guys all saw that. I think she was flipping me off.
I went this finger.
So I would definitely create embryos first. and I would totally see the best minimally invasive gynecologic surgeon, right? I'm not that person. My patients are like, will you do my surgery? I'm like, no, I suck eggs all day. You don't want me to do that advanced laparoscopy anymore. I used to do those things, but I
I had a
don't.
baby born today after the tubes that I
Aw.
blocked, actually.
Yeah.
Very
Aw.
cute.
Yeah. But I like removing them over transecting them or clipping them. And the reason why I like removing them is because my embryos are already made. It's okay if their AMH drops just a tiny bit.
But
Okay.
what if they get remarried with somebody else?
I don't know, Catherine. I haven't thought
Just
that
saying,
far.
it can happen.
Yes, it can. So they can freeze a set of eggs for husband number 2 before they have a baby. Okay. Now we're on to Kate. What?
Here's my baby
Aww,
that was
that's very
born
cute.
after I blocked her tubes last year.
Okay, this is my baby. Look what I got today. Actually, yesterday, a patient made, I bet you've never had a
Is that
patient
Matt?
make you such beautiful cookies. These are
cookies. Cookies.
I got
That's
I
so
don't know, like
cute.
100 of them.
That's so
Isn't that
cute.
cool? And then I got this cool mug. Look at that.
Oh, wow. What does it say? It's backwards.
Dr.
Aimee.
Aimee, the Egg Whisperer.
Oh, that's so cute.
I know.
I
Isn't
like
that cute? I don't want to eat the cookies though because they're so pretty.
You have to. They're so sweet.
I know.
So cute.
Sweet. Okay. Katie's question is this. Why would you ovulate through Cetrotide? In my previous cycle, I stemmed for 12 days and I didn't ovulate through it. This cycle was canceled on stem day 10, which would have been my trigger date because of premature ovulation. We're regrouping next week, but what are your answers for ovulating through Cetrotide and how would you overcome it in the future? And this is her story. 35 years old, history of DOR. Her AFC max is 6, high FSH, endometriosis, had it excised 2 years ago, then had a ruptured ectopic with emergency surgery and a left salpingectomy, also has hypothyroidism and hyperprolactinemia, recently had to have a laparoscopy to remove her left ovary from the pelvic side, or move her left ovary from the pelvic sidewall because they couldn't get the ovary last retrieval. We want to do a day 3 fresh transfer with 2 embryos since we had such a poor blast rate. What do you think?
Well, I would want to find out more about the Cetrotide. When was it given? Was the retrieval, very far away from Cetrotide? What you and I have both been doing is give Cetrotide an hour before the trigger shot to make sure they don't ovulate before. And honestly, I think in many years that I've done this, I think I've only had 1 or 2 that ovulated before. So that's very, very rare.
I don't think you've done it enough years then, Catherine.
So I haven't seen it a lot. I have seen people without eggs, but they didn't ovulate before. They just didn't have eggs.
Oh, yeah, that's fair. That's fair.
So,
that's
but
fair.
in terms of seeing, like going inside and seeing that they ovulated, I think I've only seen that once or twice in the past 15 years. So it's pretty rare.
I mean, it's a shitty day when that happens. I would say I probably see it maybe once every 4 years. It can happen, despite all my best efforts. It really.
And
sucks.
I've had people 2 hours late for the retrieval. Not that we recommend that, but somebody who was driving from 4 hours away. She was 2 hours late. I thought for sure, and she was fine. But so it depends. So I think I would definitely look at the protocol. I think it's reasonable to do a day 3 fresh transfer if she has decreased ovarian reserve, but I wouldn't just blame it on the Cetrotide. It could have just been that cycle.
Yeah, I mean, in a case like that, I would say that check your day 3 FSH when you started stem, or your day 2, not FSH, but estradiol, because it's possible you already were recruiting an egg at the very beginning of the cycle, and they didn't start or they didn't know they should have started your Cetrotide soon or earlier. And then I had a patient once, she probably ovulated through like 3 cycles before she got to her retrieval that resulted in her pregnancy. But what I did differently is I doubled I gave her Cetrotide twice a day.
Oh, wow.
Rather than just once a day. It was a very expensive cycle, but
yeah. Or you could try Lupron instead.
Or both. Or do both.
Or you could do Cetrotide and do the trigger 35 hours instead of 36 hours before, so that you don't have that happen again.
I did a second opinion consult for someone the other day, and her clinic triggers at 38 hours.
Really?
Yes.
I've never seen that.
Floored.
Yeah.
Totally.
What do you do? How many hours do you do?
I do, depending on the patient's age and story, I usually trigger at 35 and a half.
That's what I do.
Yeah, because I get all twitchy. I'm like the doctor that's like pacing, like, why isn't the IV in? Why aren't we in the room? Because I want my needle in exactly 36 hours.
Yeah,
exactly. And I hover. I'm sure you hover too. Okay.
For sure.
So next question. I think I see the word sex in this question. So Here we go.
I'm
This is
scared.
from, I'm not, maybe a little bit. You're the Dr. Ruth between the two of us. This is from Natalie. I'm 36 years old. I have rheumatoid arthritis and endometriosis. Every month is another sad day when I can feel period symptoms approaching. I get terrible lower backache when it's that time of the month. When it's ovulation time, according to the sticks, I get lower pain as well. My sex life is based around the sticks. Should I be testing myself and my husband so we don't keep trying for the next few months and maybe are wasting our time? Should I be freezing my eggs? I think that what she's saying is she just doesn't really know what to do next. Catherine, what would you say?
So I think what happens with a lot of couples is it's like a vicious cycle in terms of sex becomes just a deposit of sperm in the vagina, honestly. And it becomes not fun for a lot of the couples, and it takes the fun out of having a relationship. So I think as much as you can to try to not just save up the sperm for that one day. So what I encourage my couples to do is, especially, well, I know you're different, but with IVF cycles it's different. But for example, with IUI cycles, I tell them just have sex when you normally would. And definitely every 2 to 3 days, starting on day 10, and then try to not just focus on that one day and ovulation. Sometimes if you can, not tell your partner that you're ovulating and make it fun. You know, make dinner or go out to dinner and make it more romantic. Watch a movie. So that it's not all about just having sex for a baby, because I think it takes the fun out of it. And I think sexual problems cause infertility, and fertility cause sexual problems. I think it's like a big vicious cycle.
Yeah.
So in her case, I would make sure that she does that, but also I would do a workup for both of them for sure.
I would take it out of the bedroom. You're 36-year-old, you have endometriosis, you have an autoimmune disorder. It sounds like this stuff sucks at home. So let's just make some beautiful embryos for you.
And check the tubes, because you could have issues with your tubes for endometriosis. And the one thing to look forward to, that in pregnancy, both endometriosis and rheumatoid arthritis symptoms improve. So it's something to look forward to for her in her pregnancy.
That is true. And not just throwing up every day.
Yes. Hopefully
I love how positive you are. I would not have thought to say that. You're a good.
You would have, actually.
I probably would not have. Okay. This is a question from Ashley. Hi, Ashley. Thank you for your question. I was recently told by my OB that my AMH was 0.13. I'm 38 years old and my FSH is 18.6. I'm healthy, no previous issues. I was devastated learning this, and I am struggling to process. I know I'm just beginning my fertility journey, but what do you think it will look like? What's the likelihood I'll conceive with my own eggs? I have an appointment with a fertility specialist at the end of this month. And also I recently started acupuncture and taking supplements, including CoQ10.
Well, I think it's important to see how many follicles she has. Did you mention follicle count?
She hasn't seen a fertility doctor yet.
No, so she's never had an ultrasound. Okay, so that for me is actually more important than, I call it amine hormone, because I think amine hormone is low in everybody, AMH. So, and the FSH is pretty high, but stress can do it. I think supplements, acupuncture can lower that. So I wouldn't just get caught up on the numbers, because the numbers alone will make it go even higher. So I think the follicle is the most important thing. And obviously, depending on how many follicles she has, kind of get more aggressive with more aggressive treatments first.
Yeah, I think she still has a chance with IVF, and I would be
absolutely
if you feel comfortable being, and it's all about the quality and not quantity, and you know, be open to all the different ways that there are out there to be a mom, but certainly don't give up hope on your own eggs. What is the highest FSH, Catherine? This is totally random. FSH that you've seen for a patient that has then gone on to have a healthy pregnancy?
72.
Okay. I might be at 130. I'm not sure yet.
Wow.
We haven't yet. And then after that, I'm in the like 95. And then after that, 80.
Wow. That's impressive.
I agree.
You never know. That's why I always say, you never say never.
Never say never. Okay. So this is from Karen. Karen is 45 years old. My ovaries are normal and my cycles are regular every 28 to 29 days. My husband is 49 years old and has normal morphology, but his sperm count and motility are low. We have a beautiful 3-year-old boy from my IVF with ICSI in 2016, done with an agonist protocol. And I just recently completed an IVF with ICSI agonist protocol in August. The results were 6 mature eggs, 2 fertilized, day 3 transfer, all 8 cells, day 3 transfer of an 8-cell and a 3-cell My current stats are the following, and her transfer did not work. It was a negative pregnancy test. So her AFC is 30, her AMH is 11.78, FSH 6, BMI 22. They did give her birth control pills in August for 3 weeks before starting meds. Her doses were 350 of gonal and 150 of Luveris. And her question is, based on my history, what would you do? She's 45 years old.
She's 45. That's
45.
the main problem, but she has a lot of follicles, you said.
Yeah, and a 3-year-old from
right.
IVF
and a 3-year-old.
in 2016. What would you do?
I probably would try again. I would do supplements probably for 3 months and acupuncture and
3 months, Catherine. She's going to be 46. What are you talking about? 3 months.
But she's
Come
got a good
on.
AMH and she's got a good follicle count, and I'm a big believer in it. I think it makes a big difference.
3 months? What's magical about 3
Okay,
months?
2 months. Because 3 months is how long it takes to make new follicles.
Really? You really believe that?
I really believe that. I've seen it. I have a 46-year-old who got pregnant. He had 20 eggs.
Okay, everyone who's 45 and 46, go see Catherine.
No, because I'm not saying everybody. I have one 46-year-old who got pregnant, but she did do 3 months of supplements before she did her IVF cycle.
I need to see her chart.
Eggs.
I know you're not.
I'm showing you. And you know what her dose was? You're going to laugh. Her dose was 75 Gonal-F, 75 Menopur.
That's like the cheapest IVF protocol ever.
So she actually had 20 eggs from that protocol. It was amazing.
Okay,
I can show you.
I believe you. I mean, I would say for this patient, Karen, skip the birth control pills, number one.
Definitely no birth control pills.
No birth control pills. And if it were me, I would probably use I like the dose. I mean, she did 350 of gonal and 150 of Luveris, but I would probably try more Luveris.
I'm not a big fan of Luveris personally. I don't
think she lives in this country. That's why they use Luveris. I don't think they have it. I don't think.
And growth hormone. I would add growth hormone.
Totally, for sure. And then maybe a little bit of Pixie, as well. Pixie dust. And have your husband or partner take lots of sperm quality supplements too.
And he can get checked for his quality of sperm too.
Yeah, for sure. DNA frag. Don't just blame it on your 45-year-old eggs. It could be something else too.
45-year-old sperm.
That is true.
Could be.
Very true. Okay, here we have Joyce. Joyce's question. And you guys, thank you for submitting your questions to asktheeggwhisperer.com. As you can see, this is going so well because I'm not bumbling through the questions that I've, sloppily cut and pasted into a Word document. So thank you. This just makes my life so easy. And for those of you who have no idea what I'm talking about, I recently changed the way you guys send in questions, and you just literally go to asktheeggwhisperer.com, and it's just a really easy form to fill out. And then voila, I get your questions. And then here we are. And I'm hanging out with my best friend, Catherine, and we get to chit chat about fertility on a Friday night because there's nothing more fun than that. Okay.
And that's how we get to see each other.
That is true. That's true. I know people are like, can we have lunch together? I'm like, can we talk about fertility? Yeah. Okay. This is from Joyce. Joyce says, Dr. Aimee and Dr. Catherine, my doctor decided to use a Lupron trigger only 40 IU for my egg retrieval, which was performed on September 6th. 20 eggs were retrieved and 17 fertilized. I'm still waiting for updates of the embryos to see which reached the blastocyst stage. Today I got my period, which is sooner than expected, 5 days after the egg retrieval. Is this normal?
I have seen that a few times. The people get it 5 days after. It's not abnormal.
Right.
Most people get it 7 to 10 days afterwards, but there's nothing wrong with that.
Right, totally. This is a cute story. I had a patient once years ago. Husband calls me. He's like, there's blood dripping down my wife's leg. And I'm like, it's her period. I was like, get her on the phone. And he's like, no, she's in the shower. We're going to run to the ER. And I'm like, it's your period. Dude, it's a waterfall. Yeah. That's what's normal after the egg retrieval. And so now I kind of jokingly tell that story in a different way about how it's normal to see a waterfall. Yeah. It's normal to feel like you want to kill everyone around you. Not literally, but maybe kind of from the major PMS mood changes you're having. So you know that it's normal. Anyways, long story longer, they went to the ER and he called me and he's like, you're right. It's her period. I'm like, yeah.
You went to the ER?
No, they literally did.
Oh my goodness.
Yeah, they went to the ER. Yeah. It's a good story. Okay, Now we have a question from Leslie. Leslie is 38, going to be 39 in January. Since last September, she's had 2 miscarriages and 2 biochemicals. Today, the HCG is 6. It was 10 on Saturday and 12 on Thursday, and the period started, and now she's day 3. Doctor just canceled my letrozole follistim trigger shot cycle because a 6 is a positive HCG. She says it needs to be 5. I'm trying so hard to self-advocate, so I'm going back in for another retest tomorrow, but I'm not feeling hopeful. What, oh, what can I do to try naturally this month? Anything? Everything? Please. Any answers? I'm running out of time. P.S. My husband refuses to try IVF because of religious reasons. Otherwise, I would do it, so that's not an option. Also, why would 6 be positive if it's declining? Please help. I love your lives. They give me hope and smiles. Thank you so, so much. XOXO. Okay, what would you do, Catherine? I'm curious. Tell me.
So first of all, I do like to give people a break between miscarriages. So if they have a miscarriage, I recommend not starting right away. I think there were some studies that if people have miscarriages and they get pregnant very soon thereafter, they can have a higher chance of miscarriage. Plus, I think psychologically, it's nice to just take a month off.
Okay.
I know some people have gotten pregnant within a month of a miscarriage, and so they've done fine. So it depends on what they want to do, but they can try an insemination this month if they wanted to. They can try naturally. They can try a trigger shot with trying at home naturally. Those are all possibilities. And I would definitely do a workup to see why it happened 2 times in a row. Is there something wrong genetically? Is there something else wrong with her uterus? Is there something wrong with the sperm? I would do a workup after 2 miscarriages, even if they were chemical, because there's something going on there.
Right. I would also preserve your eggs. I mean, you don't need your husband's permission, you know, to do an egg freeze. Men can't necessarily relate to us as women because they don't run out of sperm, as in the same way that we inevitably, 100% of us as women will run out of eggs. We will all be 100% infertile. And it's fascinating to me that people still call me and they're like, oh, I'm 50, I'm ready for a baby. What can you do to help me grow more eggs? And I'm like, what?
Nothing yet. Yeah, maybe in the future.
Maybe in the future. I mean, that would be pretty awesome. But I totally agree. Think about the angel workup, looking at your AMH, autoimmune issues, looking at the anatomy of your uterus and your fallopian tubes and all that kind of stuff. Genetics, figuring out like, why is this happening before you start moving forward with the treatment? And then maybe the HCG of 6 is a sign that maybe there's something in the fallopian tube, right?
Yep. And also I would recommend talking to, if they go to church or temple, sometimes rabbis or priests can actually, you can talk to them about your situation. And I've seen this happen with some of my patients, and they give special permission to patients to have IVF. Like, for example, I had a patient who was very religious, Orthodox, and she was always ovulating before the mikvah, before she had before she was able to have intercourse, and that's why she was not getting pregnant. And so we were able to be allowed to freeze the sperm of her husband, which is normally not allowed in the situation, to be able to do the insemination when she was ready to ovulate.
You're so creative, Catherine.
So sometimes just talking to people can help.
Yes, just share your story, share what's going on, just like you did with us. And here, I'm already freezing your eggs. And do genetic testing. Don't forget that either. Okay. So this is from Kylie. Kylie has had one round of IVF and is doing another round of IVF because of low egg quality and low AMH. So now she's given a choice between Omnitrope or Sazin. Which one is better to use and why? And she adds a little bit more background. I know Sazin is more expensive and I have to keep Omnitrope in the fridge, but I'm looking for some quality eggs this go. Thank you. You're always helping me keep calm and motivated, even though you're not my doctor. Oh, isn't that sweet?
Oh, that's so sweet.
That is sweet. What do you think, Catherine?
So I haven't used Sazin as much as Omnitrope because Omnitrope is just more available and less expensive. So I would say 99% of my patients have used it. I haven't seen any difference between that and Sazin. So why not use the less expensive one?
Right. I agree. I mean, I've had patients use both. Sazin's just more expensive. I agree. Okay. And then Kylie, if you're not taking NAD, True Niagen has a brand. They need to like sign me up to be a spokesperson for them because I swear it's like part of my special sauce. I take it too. That's why I'm so energetic. I'm really 75, you guys.
I actually bought it 2 months ago, but I haven't started taking it. It's on
I take it every day. I take it every single day, Catherine. I've been monitoring my AMH levels. And I swear they're going up. I won't share with them yet. I've been tracking them over time, and I'm going to do like a big reveal to see what the AMH levels are of a 44-year-old who's been taking CoQ10. And then here's my NAD.
Yeah, that's my bottle too. It's not open yet.
Yeah, no, I take it.
Are you having baby number 5?
No. I
Something
would.
I should know?
Mm-mm.
And your new cup. I like that.
I know. I would love to have another baby. Every time I see a patient coming in, I was like, my uterus literally hurts. And so I totally get that pregnancy envy that a lot of my patients get and have, because I sometimes feel it. It's true.
I've been taking more in my 40s than in my 30s when I had my babies because I wasn't ready for them back then.
Right. But now you have Emma, your puppy.
But now I have Emma. She's right next to me, actually. Maybe she'll come visit.
I have a question. God, that Emma. She's something else.
She's
okay.
So cute.
I have a question from April. This is April's question. Hey, my question is about my friend. Isn't that sweet? Like,
okay,
she
that's
cares
cute.
about her friend
That's so
that
sweet.
she messaged us through AskTheEggWhisperer.com. Okay. Her AMH is 2.2. She has and then has male factor and low count. She got 6 eggs on Monday and only 2 fertilized. On day 2, only 1 survived, and they transferred it on that day. I can't find anything on the internet about transferring that early. The problem is that we are government funded. So if they transfer an embryo, that counts as a cycle. If it had died before making it to day 5, she would have gotten another round. Any advice or insight? Does this embryo have a chance? She says that it was this is really cute. It was a perfect embryo with 4 circles. Isn't that cute?
Oh, that's cute. So it was a 4-cell, like a day 2 embryo.
Yeah. Okay. What do you think, Catherine?
Well, when I was a fellow, because I'm that old, we actually used to do day 2 transfers. We never did day 5 transfers. We never did genetic testing. So, I mean, and people got pregnant. They didn't get pregnant as much as they do now. So I think if somebody has a lot more embryos to pick from, I think taking them to day 5 makes more sense. But I don't think it's bad to do it on day 2. I mean, people have gotten pregnant.
Oh, totally. I totally agree with you. I mean, when I started the Ask the Fertility Expert session tonight, I started with Catherine and I have known each other so long. We used to only do day 3 transfers and day 3 biopsies.
Yep, that's true.
That's true.
Yeah.
So
that was my project.
You have a beautiful day 2 baby. Are you drinking beer?
Water.
That's next Friday's live. So yeah, I mean, I would say that when it's your first embryo transfer, and when you show up on day 5 and there's no embryo to transfer, unless you've been really counseled appropriately along the way, it's really devastating. It's really sad to show up and not have an embryo there. But for some people, they feel better going in, having an embryo transferred. It's less traumatic. But
and here she is, by the way.
Hi, Emma. Hi, sweet Emma. Do you remember Auntie Aimee?
There's Auntie Aimee. You've been to her house.
And you pooped and you peed in lots of little corners of the house, Emma.
Yeah, I felt so bad about that. That was pretty bad.
I can't wait for you guys to come again. Seriously, I can't wait.
But she's more potty trained this time.
Okay, good. Even if she pooped and peed everywhere, I'd still love you and her.
Hopefully we won't get a tick this time from the deer behind your house.
You're not supposed to say anything. My husband might be watching. He didn't. Catherine, okay, I hope Matt didn't see that or hear that. Okay.
I'm just kidding.
Thanks, Catherine. Okay, this is a question from April again, but this question is now for her. I had 19 follicles, 15 over 13 millimeters. I think what she's saying is she had a lot of follicles. 15 between 13 to 23 millimeters. Okay.
That's good.
But she only got 8 eggs and 5 fertilized. She's going to do a transfer on Saturday. AMH is 4.5. She's 29 years old. And the question is this: why do you think that the number of eggs retrieved was so much lower than the follicles seen? What do you think?
Well, it could be that she has polycystic type ovaries, in which case sometimes they're empty. It could be that her estrogen level was low, which again could be that some of her follicles were empty. It could be the timing of the egg retrieval. And did you say she's doing a fresh transfer?
Yeah, she's doing a fresh transfer on Saturday.
I don't know if I would do, again, depending on her estrogen and her progesterone level, I don't know if I'd feel comfortable doing a fresh transfer in somebody with that many follicles. I think she's at high risk of hyperstimulation syndrome. Okay. And I would strongly advise to do a frozen transfer if possible.
Okay. I mean, I agree with you. I would say that the other thing is maybe they didn't give her as much of a strong trigger shot because they knew that they were going to do a fresh transfer, right? I mean, if they used only Lupron, that might be why you didn't get as many eggs. And then maybe they triggered her at 35 hours. Some people are really sensitive to that even like a 35-hour trigger might not give you as many mature eggs compared to like a 35 and a half or 36-hour. But at 29, it sounds like you're in really good shape to be successful. So Catherine and I are rooting for you.
Absolutely. And what I used to notice, because we used to do Lupron triggers with fresh transfers, we don't do that anymore. But what I noticed when you do Lupron triggers alone, more people have miscarriages. So again, not a great idea to do a transfer if it's a Lupron trigger by itself, or supplement with a lot of progesterone if you do.
Okay. So now we have about 4 more sent-in questions, and then we're going to get to the live chatted ones. Okay. Dr. DeUgarte, I'm actively working on my fitness. I'm concerned about not being able to work my abs or legs for the 2 to 3 weeks during my egg retrieval cycle. Are isometric exercises like planks or wall squats possible since they activate the muscles in a static position? What do you think?
So I usually tell my patients the first 3 days of medication's okay to do some abs and other cardio exercises, but after that I usually recommend just walking and arm weights and some mild elliptical, but nothing ab related, because I think especially if you're young and you have a lot of eggs, you can twist your ovaries. So planks work a lot of those muscles, so I wouldn't recommend that. Wall squats, I think if they're not many of them and just gentle ones, I think should be fine. But again, I just don't recommend too many abs during the process.
Yeah, I like walking. Just walk. Get your sneakers on. Walk outside. Be outside with your mask on if you need
Except for now, if you're in San Francisco, the air sucks.
It really sucks. There's like
that's why I was wearing orange.
Yeah.
In honor of your guys's.
Thank you. Thank you, Catherine. Okay, here's the next question. Is resveratrol safe to take in preparation for an egg retrieval? Is it beneficial, detrimental, or neutral? Also, I read it can increase bleeding risk. If so, how far in advance would I want to stop it prior to my retrieval?
Well, I don't think there's any studies on it before retrievals. There are some studies on it helping with fibroids. So I think if somebody has fibroids, I think it helps for that. Again, it's controversial, but I think it can help. But I wouldn't recommend it. It's not part of my special sauce, as you call it, or my soup, cocktail soup.
I would say for resveratrol, pterostilbene and resveratrol are very similar in terms of what they do. So that's why I use that one instead of resveratrol. But, I think I tell patients, whatever, you can take something in the family of like acai berry, resveratrol, or pterostilbene, and I've never noticed any bleeding issues at all. And I tell my patients, and of course, what I'm sharing with you guys and what Catherine and I are talking about is not in place of the advice of your own personal fertility doctor. We're just kind of shooting the fertility shit and hanging out, right?
Yeah.
So I haven't noticed any bleeding problems when my patients continue.
But definitely what's important, and a lot of people don't realize, is not to take aspirin or Advil, the day before the retrieval or even a week before, because that can increase bleeding risk.
Okay, here's our last question that has been sent in. Oh, actually 2 more. What do you think of mini IVF for egg retrieval? What are the pros and cons?
I don't start with mini IVF on patients because I don't think it works as well as quote unquote maxi IVF, but I do use it for patients who failed higher dose therapies or patients who are older, who have few follicles. Sometimes I have seen it help. I don't have that many babies with mini IVF as I do with regular IVF.
Maxi IVF. That's really cute. It's kind of like a maxi pad, but maxi IVF.
Maxi IVF, yeah. Because there's also midi IVF, like in between.
You're just making this up.
I'm giving you a new mnemonic.
You're totally making this up.
No, I call it Maxi IVF.
I know. Now you have to trademark it. Maxi IVF.
I'm letting you do it since you've got all the other good ones. I'm giving it to you as a present.
No. I'll email introduce you to my trademark attorney.
So cute.
Okay.
How many do you have anyways?
I have Tushy method, balls method, egg freezing party, egg whisperer party. I have, what else? Freeze and share. I think that's it.
Sperm whisperer?
I do have, I don't have sperm whisperer. I thought that was weird. I thought about it, but I do own the URL.
I know we talked about it a few years ago.
Yeah, I was thinking about having sperm freezing parties, but I'm telling you, that first party.
That seemed kind of
awkward. Because like at an egg freezing party, you can't freeze people's eggs at that party.
Good point. Got to be careful of the cups at the end of that party.
Exactly.
Right.
You are reading my mind. Okay, this is a question from Annalise. Annalise says, hi, I have an AMH of 1.3, FSH of 10.8, endometriosis and hypothyroidism. My current medications are 100 micrograms of, looks like Synthroid, Clomid, 100 milligrams, 3 vials of Metapure, dexamethasone. My follicles are growing at a snail's pace. What would you recommend for this?
I mean, I probably wouldn't add anything at this point. If there's not a lot of follicles, maybe I would just do an insemination instead of IVF if there's not a lot of follicles, and maybe try something different the next time around. Maybe the maxi IVF.
Maybe. Well, I mean, yeah, the way I think about it is some cycles are just better than others, and there's like, you just got to go with the real life experience. And I jokingly say, listen to your ovaries. Your ovaries are telling you a story, and sometimes they're telling you to leave me alone and give me a break, and then come back, and then, like you said, try a different protocol.
Exactly.
Okay, so now we're going to go to the live chat questions. Catherine, are you ready?
I think so.
Okay. That didn't sound convincing.
Well, I've got Emma here for extra consults.
Okay, here we go. I'm 43 years old. I primed with birth control pills every other day before starting cycle number 3. Have you ever heard of that, Catherine?
Every other day?
Yeah.
Never heard of that.
Me neither.
No.
Huh. Maybe that's a version of like a meaty, no, I'm just kidding, maxi. My FSH is 19.8 on day 2. AMH is 0.8. Should I not start a mild stim cycle? Or should I wait for next cycle so hopefully my levels are better?
Well, first of all, I've never done that with birth control pills every other day. So I wouldn't necessarily do that. But I mean, if the FSH looks good on day 3 and the follicle count looks great.
She said it's 19.
Oh, I thought this was the cycle before the pill started.
No, right now the cycle is this. These are the levels. Should I move forward now or should I wait?
No, I would wait.
You would wait.
Personally.
Yeah, I mean, that's
I don't
why
like starting when it's greater than 15. I haven't seen a whole lot of success with that.
Yeah. Okay. Yeah. I mean, I would say our thing is HGH, you know, if the follicle count's really good though, you know, maybe go for it. But if it's not, wait. And then if the cycle is the same next cycle, then go for it. Okay. I have endometriosis, MTHFR, looking for a new doctor. After 2 failed transfer, what can I do while I find the right doctor? To help my endometriosis and prepare for transfer number 3. That's what I'm wondering. So I'm sorry, Journey to Baby Gomez, that you've had 2 failed transfers. That really sucks. I feel your pain. So Catherine, what would you do for someone who has endometriosis to prepare for a 3rd transfer?
Well, first of all, I would want to look at her records and see if she has any endometriomas and how big they are and how severe her endometriosis is, if she's had op reports, and see what protocol she's used. I would consider an ERA and Receptiva on her to see if there's something wrong with her implantation. I think that would be good before her next transfer. And I would consider some supplements, acupuncture, and I would also look at the male factor too. I mean, you can't, even though she's got those things, it could still be a male factor as well.
I agree. And then the other thing is just consider a month of Depo-Lupron before you transfer, even without the Receptiva test, because not everyone does that test, and sometimes doctors say they don't believe in it, which is fine. You can still do the ERA test and then consider a month or 2 of Depo-Lupron before you transfer, especially if you've had 2 failed transfers. That might work.
Or just the regular Lupron protocol. And ICSI also helps in these patients too. Sometimes the fertilization is impaired in endometriosis eggs.
Okay. Here's another question. Can we freeze eggs at age 38 to 39?
I have frozen eggs up to age 45. Did I discourage my patients at 45 to freeze their eggs? Absolutely, because I do think they do better as embryos and, have more knowledge of what you have. But yes, can you freeze them? Yes. Have you had babies with them? I have, actually. I've had babies up to 39 that were frozen.
But not like 45.
No, I haven't had anybody over 40 with their own eggs unfreeze them and have babies with them yet.
Okay. I think I'm at 41 or 42 that have frozen their eggs. Okay. If the first period after the egg retrieval comes much earlier, like 5 days later, is it more likely that you'll have a later period next time?
No, I think it should be regular the next time.
Yeah. Everyone's commenting about how cute Emma is, by the way.
Oh.
Okay. Is it okay to take antidepressants during the period of IVF stimulation before the egg retrieval?
Absolutely, because I think especially taking fertility medication, some of them can make you, especially when you drop them, when you stop them, can
Mhm.
make you feel really down
Yeah,
after the hormones just stop. So I think it's
right,
very important to continue the antidepressant medications.
right. I mean, I continuously say, especially in today's times, that your mental health is the most important aspect of your fertility treatment. It's the
For
truth.
sure,
Yeah,
especially now.
yeah. Okay. Have you seen good results with HGH and low AMH DOR patients?
Yes, I mean, I do add it for patients who have failed, and sometimes depending on their follicle count, just add it from the beginning.
Right.
But I have seen patients have normal quality embryos.
Hmm.
I can't say it's just the growth hormone because we do other things as well.
Sure, sure.
But I have had many babies with growth hormone.
Yeah, me too. Do you have any recommendations to increase energy at age 40? Also, supplements to improve egg health. Is it okay to freeze at age 40?
So I have had patients freeze their eggs at age 40.
Mhm.
In terms of increasing energy, I think diet is very important. What you eat, if you don't eat a lot of sugars and eat lots of vegetables and fruits, and try to eat meals and snacks and don't just eat one time a day or starve yourself. And I think exercise is very important to
Mhm.
improve energy. Walking
Mhm.
is great. Trying to do fun things
Mhm.
as much as you can. Now we're all in the house most of the time,
Well,
but
she is doing
you
something
know,
fun. She's watching us.
she's watching us, yes, but besides us,
Oh,
there's
okay.
other cool movies and shows she can watch besides the
Right.
news. So those are important things. In terms of supplements, some of the supplements that we give actually have had my patients, they feel more energy, especially CoQ10,
Right.
a lot of the other supplements, NAD that we,
Yeah.
like you're saying,
Yeah.
you're seeing it yourself.
Right. Totally. I am. I agree. Okay. Someone's asking, oh, this is a great question. She's basically asking how your gut microbiome affects fertility and fertility treatments. And I'm going to have someone who's a fertility and gut expert on the Egg Whisperer show. I'm going to have a recorded podcast at the end of September already scheduled.
Oh,
And
I
we're
want
going
to
to
see
talk
that.
all about the fertility and gut. And we'll get into that.
That's awesome.
Yeah.
Cool.
So question is, I had an FET this week. At the time our embryo was frozen. It was graded at 3BA. After the thaw, we were told it's a 4AB. How is that possible?
I mean, number one, it could be different embryologists grading it. I think that's probably the most common reason. Everybody has different grading criteria.
Mm-hmm.
Number two is sometimes when they're grading the embryos before they put them in the freezer, by the time they're graded in the morning and by the time the freezing is done in the afternoon, they could have changed.
Mm-hmm.
And so they could have been a different grade by the time they're
Right.
put in the freezer.
Right.
And number three, I have seen embryos differ a little bit. I mean, they're not going to go from a expanded blast grade 1 to a early blast. They're not going to do that, but they
Right.
can go from a grade 1 to grade 2 with a freezing process, or they can be just slightly better when they unfreeze and they grow more.
Absolutely. It's like that kernel and the popcorn just continues to come out. And, if you
Mm-hmm.
thought like 9 a.m., by 12 noon, it's more expanded and you learn more.
Yeah.
Totally. Okay. Is 5% sperm morphology good for IUI?
Well, in the past, when you and I were fellows, again, we're getting old,
Yeah.
it was considered 14% what's considered normal
Mhm.
morphology, but now 4% is considered normal
Oh, I don't
morphology.
agree with
And
Catherine. I don't agree with that. I don't
I
think
mean, I
that's
know it's
normal. I call that
that quote unquote
sugarcoating.
normal.
I don't think it's normal.
You think
I
it's a
still
man
think it,
that changed
I
that?
absolutely, absolutely. I think that when anyone puts a reference range on a result, it's up to us to say whether that's truly normal or not. And I don't think that 4% is considered, it should be normal. I mean, sperm counts are just getting worse and worse over time.
Mm-hmm.
And then we can't just, at some point we're going to call it a sperm count of 5 million normal,
That's true. They keep changing the guidelines,
Yeah,
but
totally. Yeah.
I've had babies with that.
Oh, absolutely. 5% is good for IUI.
Yeah.
I would absolutely, the recommendation would be to do IUI.
But
And
I would
then,
also look at the other parameters, because what if
sure,
it's 5%, but the count's 5 and the
right,
motility is 5%? I mean, it's important to look at the whole thing.
right. And then my big thing is free sperm. People are like, really? You can do that? I'm like,
Mm-hmm.
yeah. If you got pregnant, freeze the sperm so that you have that really great sperm frozen. And then in 3 years or whenever 2 years you want to have a baby, you can use the frozen sperm.
Right.
Yeah. Okay, here's a great question. I'm 46. I did 3 natural IVF cycles, produced 1 embryo each time, 8 cells grade B by day 3, but no pregnancy after day 3 transfers. Any recommendations?
I'm personally not a big fan of natural IVF cycles. I just haven't seen a lot of babies from natural. I know some people do 5 or 6 before they do transfers. So
Yeah.
I know there's some doctors who do 5 or 6 retrievals and then they put 5 in.
Or they do 5 or 6 retrievals and they get 1 egg because of
Yeah.
the lack of control. And yeah, but
I mean, I would recommend trying to do, again, higher dose, maybe with growth hormone supplements, and trying to get more eggs and taking them to day 5 and doing genetic testing to see if there's any normal ones, because most likely they're all going to be abnormal at this age, unfortunately.
Right, right. I agree. Okay. Should I take all of the supplements on the egg quality video or egg health? So I have a YouTube show all about egg quality supplements, and I individualize my recommendations, and I know you do too, Catherine. So the answer is no. I don't think you should take all of them, but you should talk to a fertility doctor about what your diagnosis is and consider a supplement regimen that would address that. Right, Catherine? Do you agree?
For sure. Yeah, because everybody's different.
Right. Here's a great question. How do you feel about surrogacy? I'm 44 years old. My AMH is 0.13. I've done 6 IUIs, 1 pregnancy that lasted a week. What do you think?
I mean, I wouldn't suggest surrogacy at this point, just with one failed cycle. So, but I mean, surrogacy is always an option, but it's not cheap and not easy to find surrogates. And especially now with COVID, it's a lot more difficult to get them to places, you know, if they live in different states, it's a lot more dangerous. So I wouldn't go to surrogacy as the next best step at this point.
Well, yeah, I mean, I think at 44 years of age, the issue is probably not the uterus, it's probably the eggs. And then if you're so lucky to get a healthy embryo at 44, at that point, say, maybe I should consider using a surrogate if my doctor thinks my chances would be higher for whatever reason because of other things. But yeah.
Yep.
Okay. Here's a great question. Hello, doctors. I'm 35. I have 1 ovary due to a granulosa cell tumor. No chemo. I took my IUD out 2 weeks ago. I'm on prenatals, omegas. I ordered CoQ10 and Ovasitol. Any other suggestions? My ultrasound is normal.
So again, I would want to get more of a history in terms of what medical issues she's got. Go to your video about which supplements. There you go. Do all the workup. Tushy method. I think that's great. I love your cookie. Can I have half of that, by the way? It's been a long day.
If I could reach in there and give you a cookie right now, I would.
We have to figure out. Don't you have a drone over there that you can send it to me?
I should. Down to Westwood.
We're not that far.
No.
So anyway, so I think that she needs more of a workup before figuring out next steps.
Yeah, I agree. I mean, if you've had a granulosa cell tumor, you've had surgery, you've had, you know, risk for tubal factors. So make sure that your remaining fallopian tube, I imagine they took out your other tube, is open. And then think about your AMH, how many kids you want, what it's going to take to get that at your age, and then go do it.
Exactly. I like that.
Okay. Catherine, we're almost done. Instagram is going to turn off the lights, close the doors on us in like a few minutes.
Let's see if Emma will do a dance for us. Emma, will you do a dance for us?
Let's see.
Emma, dance. Hold on. Wait. Dance.
Oh, great job.
Dance. There you go. She did it. Okay.
Aww.
She's been waiting the whole time to do that for you.
Okay.
That's a special dance for Aimee.
Thank you, Catherine. So there are 2 last questions that just got posted, and then we'll end because it looks like we probably have like 2 more minutes. I haven't gotten the official countdown, but it's coming soon. One more question. How much higher is the percentage of pregnancy at 44 compared to IVF? I'm going to be 45 next month. I've done 6 IUIs. Is it worth trying?
I think it's worth trying IVF over IUI because it's going to be higher, but unfortunately the pregnancy rates aren't a lot higher because of the age. So I think it depends on the AMH level, follicle count, everything else.
Yeah. This is a question. I had 3 pregnancy losses in 2019. Last loss was in December. Haven't been able to get pregnant since. I've been working with a fertility doctor, but what would you recommend?
So what do you think?
Angel approach. It was my last Instagram post about looking
today.
At autoimmune, your AMH, look at your anatomy, think about nutrition, genetics, karyotypes for both you and your partner, sperm DNA fragmentation testing, rule out endocrine abnormalities, look at your lifestyle, and then make a plan.
And maybe do acupuncture.
I should add that in the A, acupuncture.
Yes, A for acupuncture too.
A for acupuncture.
That's good.
Or see Dr. Aimee. Too bad there isn't
A for Aimee.
Too bad there isn't a D in there. Then we could say see Dr. DeUgarte.
I have an A in Catherine.
That's true. I guess that counts.
Close enough.
Yeah. And then here's a question. Do you believe AMH can change? Is it consistently reliable?
I actually have seen a patient recently that went
Yeah.
a whole point higher in a year before baby number one, because some people
Yeah.
worry about their AMH or baby number two, and
Yeah.
I have seen it go up actually.
Yeah. I mean, my AMH is going up. I mean, I
See,
am
there you
on
go,
the
from
supplement.
NAD.
Yeah. Okay. What's the success rate of an unmedicated genetically normal transfer?
It depends on the age.
Yeah.
So, but I usually say if it's a genetically normal embryo, it's usually about a 50-50 thing.
Yeah. Depending on the quality. Remember your embryo diamonds.
Right.
Embryo diamonds.
So cute.
So, you guys, I should probably trademark that. Someone's
You need to
asking.
make like a periodic table of Aimee
I have it.
mnemonics.
No, I have it. It's coming out soon. It's coming out soon.
I want to put it in my wall here, right behind me.
Dr. Aimee
Instead of my kids.
Someone's asking if this is recorded, and the answer is yes. It'll be up here in about 10 seconds because we're almost done. And Catherine, I love you.
And I didn't sink this time.
And you
Did
didn't
I?
sink. It wasn't like you were in a pool of sand, whatever. Okay, you guys. Love you, Catherine.
Love you.
See you soon. You guys
Bye.
have